And you're in for a treat, folks, because we're about to learn at a very high level about an extraordinary opportunity with Carillumina. And it's my distinct honor to introduce to everyone the very person who thought highly enough of me to give me a call in mid to late December. And folks, what I saw, what you're about to see here, just blew me away. Each and every time he does this presentation, folks, he knocks it out of the park. And this individual, folks, has earned my sincere admiration and respect over the years, and allow me to bring in none other than Naples' very own Mr. Ken Chickk. Ken, are you out there?
I am here. Can you hear me, Michael?
Oh, loud and clear, my friend. A little bit louder would be good, though, Ken. Just a tiny bit, if you would.
Let me see if we can work with that. Is that better?
Oh, much better. The floor is yours, my friend.
Awesome. Awesome. Thank you so much, Michael. I appreciate not only our friendship, but you've earned my respect and admiration as well. I can't thank you enough for, we've worked together, for you guys that don't know this, worked together on other projects. And Michael is not only a great friend, but he's a great sponsor. Even though I had the opportunity to sponsor him here, for you guys that are on his team, he's phenomenal. You've got a great sponsor there, a great mentor. And the thing about Michael that you're going to learn too is that he'll serve you no matter where you're at in this company. That's our heart here. We want to help everyone. We are one team. It's not about Michael's team, about my team, about Kenny and Francis's or Tony's. We're one team, and our heart is to help everyone here succeed at the level that they want to succeed at. And so we want to welcome you to the webinar. We're going to ask you to go ahead and please turn off all distractions and turn up the volume, because what you're about ready to see here is what many of us on this call believe is the most incredible opportunity we've seen in our collective careers, and we believe that you're going to feel the same way after you walk with us through this webinar. Let me just go ahead and get here. All right. So what we're going to talk about tonight is genomic screening, and it is what we believe is an opportunity of a lifetime. And again, we believe that you're going to feel the same way after you walk through this webinar with us. What makes this a great opportunity? It's very simple. You have the opportunity to participate in a program that is directly involved in the fight to eradicate cancer. Not only that, we're also have an opportunity to help stop the 5th leading cause of death in hospitals today. That's prescription medication deaths. Last year, I did a little bit more research on this. I'd heard different numbers on this, but last year, over 106,000 people perished because the medication that they were taking was having adverse effects. 670,000 ended up in the hospital over it. 5th leading cause of death in hospitals across America, and we have an opportunity to help reduce that number as well. We're going to listen from an oncologist right now who just shares about who should get genetic testing for cancer.
I would say the first and foremost thing is if you've...
Sorry, guys. We had this little... I think this is Zoom that does this. Let's try it one more time.
I would say the first and foremost thing is if you've either had cancer, find out if there is a role for genetic testing. Not everyone should be tested for genetics, but certainly if you've had a personal history of cancer, maybe, or if there's a strong family history of cancers in your family and you're not affected. The point is we just need to keep getting the message out, awareness out, and just keep trying and trying and trying so that we don't see patients that come into my office maybe once every other week. Someone walks in the door where you look and say, oh my God, look at this family history, or they should have seen this coming. They didn't do genetic testing. We could have prevented this. So really what we're getting at with genetics isn't just to know or to find out about your genes, it's to be able to prevent cancers, not just explain why we got cancers. I mean, it is inexcusable. I won't even use the word almost. It is inexcusable for someone at risk that had a family history to end up with cancer and then find out after the fact they had a mutation and they could have been tested for it. That's inexcusable. So there's very few excuses not to get this done. I think the main excuses are ignorance, both on the healthcare provider side and the patient side. And I don't mean ignorance in a derogatory way, just not knowing or not being aware. And we can make excuses about it, but I don't care. We just need to get over it. And whatever it takes, whether it's a movie, a lecture, newspaper article, another Angelina Jolie, whatever it takes, we need to get the message out.
We need to get the message out. And that's exactly what we're doing here. We look at it way more than a job. We look at it as a mission, and we're going to do everything we can to help eradicate cancer and reduce prescription medication deaths. It's an awesome and honorable field that we're in, and we're very, very excited about it. Today, you're going to have the opportunity to participate in a program that's not only helping save lives, but also has the possibility of significant financial rewards in the booming genomic screening industry. Now, we're going to talk about two separate companies that have the same founder and CEO, Mr. Fraser Burns, and why this is important. You're going to see in the next few slides the advantage we have because of this. Like no other. As a matter of fact, I'm going to challenge anybody that might be on tonight that if you are investigating us and doing your due diligence and you are maybe looking at other companies, if you can find a company with better infrastructure, we say go ahead and join it. But if you can't, we want to challenge you to come on board with us, because where we're going, man alive, this is very, very exciting. So the two companies are Essentra and Carelumina. And why is this important? Well, first we're going to look at Essentra, and we're going to look at the strength of Essentra. It's a 23-year-old corporation that's a registered medical facility. You're going to find out why that's important here in a second. They employ over 1,300 board-certified medical physicians who determine medical necessity when it comes to the genomic screening. They've processed and submitted over between 8,000 and 10,000 screens per month to labs over the last 4 years. If you do the numbers, they've submitted over 400,000 of these genetic screenings over the last 4 years. 14 labs in at least in each of the 13 Medicare regions. And this is another thing that's incredibly important. And one of the reasons why is because they don't have one lab that they can choose from. They have 14. And when the screening comes in, they look at which lab would be the best fit for each individual screening, and they send it off to that lab. They have well over a 90% pull-through rate. That means from submission to completion, over 90% of those submitted are completed and paid out on. Another phenomenal statistic. Over the last 23 years, they've serviced some of the largest companies in America and around the world. Wells Fargo, Discover, Hilton, Dish Network, Sprint, and the list goes on and on. They also service hospitals, doctors' offices, insurance agencies. They white label for many of these companies. They've got over 4,000 employees internationally. So this isn't a company that just got a great idea and put some salespeople together and they're building the plane while it's in the air. This is a company that's well established, and we're and loaded for bear. We're a 747 brand spanking new on the tarmac, and here's why. Carelumina is the company that we are contracted with as screening specialists. And it's a direct selling company that was founded by Mr. Burns, 3 of his closest friends, and 2 venture capitalist firms. It's been in existence for just over 2 years, and for the last 2 years, they've been specializing in health and wellness products and beauty products. Why? Because, number one, Mr. Burns saw that there was a need for a high-end product in this field. He has 2 very close friends, 2 of the partners, are both surgeons, one's a plastic surgeon, and the other is a cardiologist that's the head cardiologist over a chain of hospitals. Both of them are nationally renowned. And the 3 of them collaborated, they put their heads together and said, we can come up with a better product. And for the last 2 years, they've been in this direct selling space with products that are far superior than what's on the market. Now, we as genomic screeners, we have no requirement to buy or sell the products. But just about, well, before I go into that, the point is the company has a very strong infrastructure and they are financially backed to the hilt. So it's already in place for us. Again, like I said, they're not building this plane while it's flying. This plane is on the tarmac and it's a brand new 747 and it's getting ready to launch like Seabiscuit. Just recently, they introduced a new division in genomic screening as a service to the general public. Now, Ocentra is B2B. It does not work with the general public, only businesses. And they white label for other companies similar to Carelumina in many of the products that they carry. One of them, genomic screening. That's why they have submitted over 400,000 in the last 4 years. Just recently, though, they started their own. Again, Fraser Burns saw that it could be done better, and he had the infrastructure to do it. Now, there's 3 important steps that we want you to know that go on when submitting these DNA, and we feel it's important enough for you guys to be aware of it when we submit the screening swabs. First, we are contracted screening specialists with Carelumina. So we're the first step where we go out to the public and introduce the education and start the screening process. Once we do that, Carelumina has contracted with Ocentra. So we send the swabbing kits to Carelumina. They send them to Ocentra, which is right in the same facility. And Ocentra is the medical facility. And by the way, the medical facility cannot legally do the screenings. So Ocentra does not own Carelumina. The only relationship there is that Mr. Fraser Burns founded both companies and he's the CEO of both companies. So legally, Carelumina can do the swabbing. We send it, we as advocates, we send it to Carelumina. They send it to Ocentra, who then, Ocentra also determines medical necessity. We're going to be looking at that, receives the DNA samples, and then Ocentra processes and sends the samples to one of the 14 labs who they are contracted with. It's pretty seamless. Now, as an intake specialist, our responsibility first is we must complete the required training and HIPAA certification. Second, we provide information on behalf of genomic screening to the general public. After we educate the public, they're going to want, some of them are going to be qualified, so we will pre-qualify the patient, and after we pre-qualify them, we input their data in a HIPAA-compliant electronic health record, which Ocentra developed this software for hospitals, doctors' offices, and insurance agencies a number of years ago. It's all in-house, and that is another great advantage of being connected with Mr. Fraser Burns. So then after we input them into the EHR, we connect the patient with a third-party verification team member. This is an outside company that we use because Medicare wants an outside company. It's not required, but Medicare favors if a screening company uses an outside company to verify the information. After the third party verifies with the patient that the information is true and accurate, we then connect them with the telehealth doctor who then determines if there's medical necessity. We will not push through or we will not submit a sample if there's not medical necessity. This is very important. We'll explain that a little bit more in the next slide or two. The telehealth doctors do work for Ocentra, so that's another huge benefit. Like I said, we have over 1,300 board-certified medical physicians that will determine if there is medical necessity. We then swab the patient, And if the telehealth doctor is not available, we can still, as long as we've got the third-party verifier who cleared everything from that point, we can then go ahead and swab them and schedule a time for the physician to call them. We then send the swab to Carelumina via the United States Postal Service in a priority box. And it's pretty simple. There's not too many moving parts here. Now, what qualifies a patient for screening? First, they've got to have the correct insurance, and it's Medicare Part B or Medicaid in some states. Now, this is very important, and it's pretty simple. All you do is ask to see their Medicare card. If it looks like the one on the top, Part A only, they do not receive any. We don't do the screening at that point. They don't qualify. We only qualify those who can receive the screening. We only screen those who can receive the screening at no cost because they're qualified with the proper insurance. That's the first qualification. Down here at the bottom, you see this card here is it has the Part A and Part B, and that's what we're looking for. So if they have Part A and Part B, it's pretty simple. Okay. There are certain PPOs and Medicaids in certain states. Humana, Cigna, Aetna, United Healthcare, those PPOs are accepted, and Medicaid right now in Colorado, Missouri, and Georgia, and they are negotiating with 15 other states right now, but don't ask me which ones they are. I've had a lot of people do that, and that's out of my pay grade. So it's okay if we have just the 3 right now, because there are 60 million people on Medicare, and a majority of those have Medicare Part B. This is wide open for us. Now, the Medicare is issued at 65, but there are people on disability that have it as if they're on disability, they can qualify, I believe, as young as 25. But with Medicaid opening it up, that will lower the age to, I believe it's 21 and go all the way up to 85. So it's very exciting. We are in a great space at the right time. The second thing that qualifies them, once we know that they have the right insurance, is the degree of historical cancer that runs in their family. If they are a survivor and they have the right insurance, they qualify. They'll need one more qualification. We're going to go over that, but they've already passed two right there. If they're not a survivor, but they have what's called a first-degree relative with the history of cancer, a parent, brother, sister, or child, then that would qualify them. Or 2 second and third degree relatives with the history of cancer. What they're looking for is genetic markers, and that's why there needs to be a history of cancer in the family. So any 2 of these, grandparents, uncles, aunts, all the way down to first cousins, they would be qualified. Okay? The third qualification that they need is a chief complaint. Medicare is trying to increase the quality of service and save people's lives. And there is a high risk of cancer if there's hereditary cancer in the family. So they're honing in on hereditary cancer. And if an individual has a chief complaint, this is the third thing that would qualify them. And what is a chief complaint? It's pretty simple. And this actually, I took this screenshot right off of the computer from the intake. I believe this was in our training. So I took this right off, but this is what the electronic health record looks like on this page. Chief complaint could be anywhere from they can't sleep at night, or they feel lethargic during the day. They're always nauseous. They've got a stomach ache, a backache, lower backache, upper backache, shoulder pain. It could be a variety of things, lumps near the lymph node areas. There's a variety of things. So we also do, and you can see right here, we do a pharmacogenomic screening as well. So if you have the customer and they're in front of you, and maybe they might not qualify because they either don't have hereditary cancer in their family, they might have the right insurance, but no hereditary cancer, or no chief complaint for hereditary cancer. Well, if they are taking one medication and they're having adverse side effects, that will also qualify them for the PGX. But you can choose that right here on the electronic health record. So they have to have a chief complaint. They have to have relatives with a history of cancer, and they have to have the right insurance. They have those three things, and now they are pre-qualified. And then you open up the EHR and start to enter the information. Now, at this point, we are going to talk about the potential here that you can earn as an intake specialist with us. And I'm going to read an income disclaimer. As with any business, your results may vary. The results may be based on your individual effort, business experience, your level of desire, and there are no guarantees concerning the level of success you may experience. I'm a little tongue-tied tonight. I don't know why. Maybe I should have had a cup of coffee. But the pay plan for qualified screens, and if you notice, that's qualified screens. If you submit something that's not qualified, you're not going to get paid on it, of course. And we just went through the qualifications. So and what happens too, once the lab receives the swabs, they immediately pick up the phone before they do any lab work, and they call the third-party insurer to make sure that the third-party insurer is going to pay for it. Once that is cleared, it goes through, and that's when payday happens for us 15 to 45 days later. And the reason why it is 15 to 45 days depends on how clean or how accurately we filled out the EHR. So how it works is very simple. Doesn't matter where you come in. If you come in today, if you came in today or 2 months ago, if you're at the very beginning or if you're at the top of the pay plan, it doesn't matter. Everyone receives $600 per qualified CGX screening. CGX is cancer genomic screening. That's what that stands for. And you receive $180 for every PGX screening. So if you're in a house or you're at an event and you screen somebody and they qualify for both the CGX and the PGX, that's right, you're going to make $780. Now, I had a friend of mine here in town call me up, and he said, hey, Kenny, I've got some people at my office. I believe they qualify. Would you mind coming down and help me doing a screening? So I went down there, and there was a couple, husband and wife. They qualified for both CGX and PGX. You do the numbers. In about 3 hours, and it took us 3 hours because we were having a little bit of difficulty with my not my laptop, but my tablet going offline. So we had to re-enter the information. And I figured out how to fix that too. So you have to hit the next button as soon as you're done inputting any information, and then that saves it for you. But it took me a while. So that's a little pointer there for you guys that are getting ready to do screens. Hit the next button. But he made, what was that, $1,560 in a 3 hour period. It probably would have only taken us about an hour and a half, maybe at most, if my computer wasn't glitching. She was on 18 medications. 18, okay? She kept saying over and over again, I don't know why my doctor's prescribing me. I ask him what this is for, and he tells me I need it. So they both qualified, and we had another guy, one of the guys on my team as well, one of the guys I brought in early, Dan Shipley. Dan went and called the lady. He knew that she qualified, or he had a good feeling she qualified, and he's telling her, hey, we offer cancer genetic screening at no cost for those that are qualified. She stops him and says, hey, do you mind if I call a couple friends and ask them to come over? And so he gets over there, and there's 3 people waiting for him. All three of them qualified for CGX, and 2 of them qualified for PGX. That was $2,160, I believe, that he walked out of the house, and it took him 3 hours and 30 minutes to do 3 people. That's not a bad payday for working part-time on an afternoon. Now, there also are overrides that are paid through 6 levels up, which is incredibly liberal for us, and bonus pools for those who qualify. This is such a great plan. When you see this, it's really amazing. We're going to look at right now about building a team. Now, there's no requirements to team building. You can go out, and if you do the numbers, you'll see it's incredibly lucrative. Just start doing the numbers, running them. How many screenings do you want to do a week? we're finding that if a person goes to work, if they go out and generate a few leads, it's easy to do 2, 3, 4, 5 of these a week. So there's no requirements to building a team. You can make an incredible income without building a team. But there is the potential of a much larger financial reward, and it's definitely worthy of all of our consideration to build a team. And we're going to look at right now, this is just a bird's eye view. This isn't detailed. If you want to go in, you can pick apart the comp plan by going to carelumina.com, go into opportunity tab, scrolling down, there's a PDF, and it has changed a little bit because this is for the genomic screening, which we're showing you right now, but the points are still the same. And I believe to get to manager, you only need 3 points, and it's you get 10 points for every CGX and 5 points to a PGX. And I believe to get the manager, you only need 3, and you have to introduce 1 person. Now you get paid, as we said before, $600 no matter where you're at in the pay plan for your personal production. You get $50 for every time somebody you personally introduces goes out and does a CGX screening. We're going to look at PGX in a minute. So for personals, we all get the same across the board. Where it changes, though, is if those that we personally introduce go out and introduce a few, who go out and introduce a few. And how it works is the first person, we receive 50. As a manager, we receive 10 for the next 5 generations. Now, you start doing the numbers, guys. It's very easy to get up here to senior manager, but even at manager, $10, if you start doing the numbers, is incredibly lucrative. As a senior manager, all you have to do is bring in 2 people who qualify as managers. Remember what I said? 1 CGX or PGX will qualify them as a manager. And I don't believe they even have to recruit anybody. They just have to go out and do 1 screening a month. Okay? Now, if somebody can't do 1 screening a month, I'm going to tell you what, they're either working too hard or they're not working enough. It's one of those 2 things. Okay? So a senior manager, you get $20 for the next 5 generations. A regional manager, you get $30 for the next 5 generations. A national manager, $40 for the next 5 generations. Director, $40 again, but you get an $800 car allowance. And as a presidential, which is the highest level on our compensation plan, you get $50 for 6 generations. Now I'm going to tell you what. I've been working now since December 11th. Okay, now when I saw this, I decided to go to work. I said, this thing is going to go viral. It's too good not to. It has everything in place, from the leadership, the financial backing, the infrastructure, and I've never seen a comp plan that pays out this much money ever in my life. On top of that, it's for a product we don't sell. We are offering a product that can save people's lives by early detection, and we are offering it at no cost to them. When Francis Williams told me this, and Francis and Kenny are who sponsored me, I'm like, holy smokes. I joined immediately, and I went to work. Now, I've brought in a total of 26 people frontline to me. My team has grown, I'm looking at it right now, to 347 people in just 2 days over 8 weeks. Now, why has it done that? I'll tell you why. We've cracked the code, people. Not only do we have a great, great company and a great program like nothing any of us has ever seen before, but this isn't our first rodeo. But this is the easiest horse we've ever run, and he runs faster than Seabiscuit. I've never seen this type of growth in this short a time. And I'm going to refresh the page right here, just if you don't mind. I'd probably have to log in, but incredible. So everything that I've shown you right now, that's not where the real money is. The real money is what you see down here. This is national generational bonuses, national manager, director, and 2 presidential bonuses. This is where the real money is in this comp plan. Let me tell you, it's not hard to get to director, and all you need is 4 directors to get to presidential. Guys, we're going to have people here that are going to break records in this industry. And if you think for 1 second that they don't have their ducks in a row already, because Medicare is not going to pay out forever. We know that. But we've already introduced hormone replacement therapy that will save the general public between $500 and $1,000 a year. We've got other screenings that are coming. I'm telling you guys, this is going to be the greatest build many of us will ever see in our lifetimes. And it's going to be generational. So let's go on. I'll stop there. It's already been 30 minutes and we're almost through this. Thank you so much for your patience. We're going to look at pharmacogenomics real quick. You get 180 across the board for every pharmacogenomic screening you do that's qualified. And 15 on your first level. Those are your personals. And then you can see 3 if you're a manager, 6 senior manager, 9 for regional manager, 12 for national, 12 for director, and 15 for presidential. And then we have generational bonuses down here. Again, you can slice and dice this to your heart's content by going to carelumina.com. You'll see what the qualifications are to get to the next level. And you're going to see I'm being fully transparent here. It's very easy to rank up. That's the other thing I liked about this company. You know, a lot of companies, you've got to pull out your calculus calculator to try to figure out how these comp plans work. This is so simple, and they did it on purpose because they were tired of what was out there in the industry. Fraser Burns told me that himself. Tired of what's out there. So he made it very simple, and I'm so thankful for that man. I'm so thankful for Kenny and Francis Williams, Tony Baldwin, and everyone that is helping us and mentoring us. So what does it cost to get started? Well, you know, I've been in online marketing full time for almost 8 years now, about 7.5 years. And I can tell you personally that I've seen programs that cost $15,000 to get started and don't offer half of what this, don't even offer a portion. Oh yeah, you can get your online marketing suites and all of that, 15 grand. I've never ran with one of them. This one is only $200 to start. And for $200, you get your training, your credentials, you get a separate complete system for the HIPAA compliant electronic health record. And there is a $25 monthly fee. For that, you have use of the EHR. You have a 24/7 telehealth doctor. That's a board certified medical doctor that you can call 24 hours a day, 7 days a week, and they will return the call quickly. I've already had people on my team call me and say, hey, Kenny, I got sick and I called the telehealth doctor and they called me right back and wrote me a prescription and took good care of me. So it's a 24-hour health that you and your entire family have use of, by the way. It's not just for you. It's for you and your entire immediate family. Not if you're Italian like me, it's not for your extended family that reaches hundreds and hundreds of people. It's only for your immediate family. Now, what is the training bonus? Now, you receive as an enroller, when you personally enroll somebody, you receive a $100 training bonus out of that $200 for each personally enrolled team member that goes through the training. So you don't get it just for enrolling them. You get $0 for enrolling. You get $100 from that training fee. 100 of it goes to you to help your team and see them through. Not only you get 100 for your personals, but you get 20 for their personals, because the company knows you're going to be working with your personals as well. But it stops there. And if you're a good leader and a good mentor and you serve your people properly, you're teaching them how to train their people as well. So it shouldn't go further than 2 levels anyway. And you must ensure, if you notice at the bottom, you must ensure that the training is completed. And that's when you get paid, when the training's completed. Okay, Now, I want you to go ahead and take out your phones and take a screenshot of this, because this is really important. If you didn't get all the information you needed, or you didn't take notes and you can't remember everything, I know we covered a lot. What you want to do is take a picture of this, because we have webinars 7 days a week, live webinars. These aren't recorded ones where you go in and you look like you're going to watch a recorded, a live webinar, and here it's a recording. This is 7 live webinars a week, or a webinar 7 days a week. We actually have more than 7. We've got training webinars too, a training one on Saturday that our fearless leaders host, Kenny and Francis Williams. And we just want to thank you so much for your time. And we want to invite you to get back to the person who invited you here and join us in our fight against cancer. Get all your questions answered. And if this is a good fit for you, and if you haven't found something like what I just shared with you, and you're looking and you're doing your due diligence, I challenge you to come on board with us. If you have seen this, I don't think you're going to find anything better than this. If you do, call me. Call me. But I know I've told people that over and over again. I haven't gotten a single phone call yet. This company is that strong. And I just want to encourage you. We want your success. We want to see you succeed as much as you want to succeed. And we'll help you. We're not going to push you. We're not going to pull you, but we'll walk with you. It was great to have you here. It was an honor to be the host for tonight's call. And we wish every one of you incredible success, no matter what you endeavor to do. You have a great night, and God bless you.